My name's Cesar.
My name is Tania Portillo.
My name is Margarita Villalobos.
My name is Sarah Mendez.
My name is Norma Nevares.
My name is Nancy Espinosa.
My name is Andrea Alvarado.
I've been a nurse for almost 15 years.
6 years.
Almost 3 years.
2 years.
A little bit over a year.
10 months already.
Only 4 months.
My name's Angie Olivas. I've been here for 41 years, going on 42.
I love nursing. I love my job. I think it's very rewarding again. When you see your patient, you see them get here, transferred from ICU, from the ER, and they come very sick. And to see them being discharged and being able to go back to their house and able to kind of function, go back to what they used to be, it's amazing to see that.
Helping others when they're at their worst, when they really need somebody to be there, it's just really rewarding.
Just yesterday I had one that was from Georgia, came here, was diagnosed as a diabetic. He was like so lost, but when he left yesterday, he said, "Thank you so much, you taught me everything I needed to know." And I taught him, even though he left late, but I taught him everything he was gonna need before he got back to Georgia.
I remember a patient we had actually when we were on the 5th floor, and he had been in a very bad accident in the highway, and he wasn't from here, so he couldn't really speak English, so we had a hard time communicating with him. But I remember him being in the hospital for like 3 months, and you know, he couldn't walk, he couldn't talk, he couldn't feed himself. And after those 3 months, I mean, we would see him walking in the hallways, and he was just like family to us. And even though we didn't speak the same language, I mean, we were all very happy for him, and he was very grateful.
As a nurse, you have to put yourself in the patient's shoes and also the family. Imagine if you're the family, what kind of care would you want to have for your own family and for yourself if you were in the hospital?
Empathy, well, you feel connection here in the ICU, not only with the patients, but with the family members as well. You make a lot of connection, and just by talking to them and letting them know from the very beginning in the morning what's going on with their family member, they're going to be so grateful just for them to know that you're listening to them, and you can just spare 5 minutes of your time to explain.
Patients express their gratitude and let you know that you made a difference. You know, they tell you, I wasn't feeling well when I came in, you know, I was a little bit nervous to come to the ER for this particular problem. And of course, we make them feel better. We tell them, you know, that's what we're here for. And when they leave feeling a lot better, you feel just like you did your job.
I've always liked the emergency room. I could never think of working anywhere else.
Okay, I'll be right there. Thank you so much.
Okay.
I think the trend towards having male nurses is changing. We are having a lot of more male nurses. Females tend to be more caring, patient, but you know, you're seeing more males that are not afraid to say, you know what, I'm caring too. I can be just as patient. I can be just as caring. Especially in a surgical unit, you need someone strong. So sometimes you need your male staff, you know, to lift patients, to move them, turn them. So that's a trend that I think is going to be changing, and it's going to continue changing.
What kind of advice would you give to a person who's just starting out in this field?
I would say to focus on the patient, be proactive, and do a lot of reading so you can know how to treat the patients.
If you become a nurse, you have to love what you do, not just here for the money. You gotta love to take care of patients.